Hi Lamia, how are you?
Hello, hello, my dear. How are you?
Good, good. Okay, so you can hear me?
Yes,
Perfect. Okay, so shall we start?
yes, ready?
All right, perfect. So thank you everyone for joining us today on the Centering Care in the MENA region webinar on valuing care and looking at it from economic perspectives and exploring alternatives. Thank you so much for joining to listen to this very timely conversation on the care economy. And our guest speaker today is Ms. Lamia Al Mubayid. Lamia is a development specialist. Her experience spans senior positions in government, international development, and the private sector, working for and with the IMF, the World Bank, and UN agencies. She currently leads a Center of Excellence in Governance and Public Financial Management, is a non-resident senior international fellow at the Asfari Institute at the American University of Beirut, and advises at global level on Agenda 2030 for Sustainable Development as Vice Chair of the UN CEPA Committee, the Committee of Experts on Public Administration. Her various roles presented her the opportunity to witness, act on, and publish about major development issues in the countries of the Middle East and Africa, particularly on topics including governance, public spending, gender, and sustainability. A fervent supporter of South-South cooperation, Ms. Mbayed contributed to creating 6 institutes of public finance and to the foundation of 2 knowledge networks in the Middle East and North Africa region. In 2016, she was elected to the board of the International Association of Schools and Institutes of Administration. Fluent in 4 languages, Ms. Mbayed holds a master's degree in agricultural economics and development from AUB and certifications in strategic management, policy planning from the UK. She was awarded the prestigious French distinctions of Chevalier de la Légion d'honneur 2015 and l'Ordre national de mérite in 2004. Lamia, thank you so much for being with us today, and the floor is all yours.
Thank you, Sarah, for this introduction. It's lovely to be here, and thank you for all those who are joining us today on this seminar. Today we're addressing the economic side of care, and as you well know, this is a side that is somehow not really measured. Let's put it in this way. So we'll try to discover a little bit what is it, what and how can we actually, give more sense, more numbers, more and also more importance to it, because what we do not measure sometimes we do not does not count in our society. So let's try to see how this unfolds, and I will start with a presentation, and then we can take a few questions and have a discussion around what I'm saying.
Of course.
Um, if this is okay with you, just confirm to me that you can see my screen. So today we're addressing why do we care about care? So we start by first asking this question, and then we will see how does care affect women in particular, and why it is important today more than ever, and how can we make it work for women in general and the economy. You can all see my slides. Is it clear?
We can, yes, yes.
Okay, sorry. So we proceed. Okay. So let me first start by addressing the question of care,
Let
not
me,
as, yes,
yes, I'm sorry to interrupt. Would you be able to put your PowerPoint in full screen? Yes,
that's
perfect.
it. You can see it. Great, super. Okay, super. So let's first try to answer the question, why should we care about care? It's not a straightforward answer, but through this question, there are some basic principles that I would like you to keep in mind. First of all, that care is, of course, and we all agree about the cruciality of it. It's a center, whether paid or unpaid, we all acknowledge that care is crucial to human well-being and to the pattern of economic development. If imagine a world without domestic workers, imagine a world without somebody to take care of children while parents have to go to their job. Imagine a world where there are no persons able to dedicate their time to cooking meals, to cleaning, to taking care of the sick, of the elderly. This is a word that cannot work. The economy cannot work without care. It would simply not function. Economists in general like to define care as a public good, meaning that its benefits, what it generates to the economy and society, it extends beyond the beneficiary, the direct beneficiary. So for example, when you care for young children, this is a critical investment in the health, in the education, and the productivity of future generation. It's not only, caring per se about this particular young child. It is caring about the future generation somehow. Caring for the elderly, it helps ensure dignity, longer lasting health, of course, but well-being all over for society. And these are the types of externalities that make us understand that care is not only about economic value, it is also a public good. And this is important. Please have it as a center, center sentence in your way of addressing care. Although it's a public good, care is rarely recognized as having an economic value, and this is the paradox of it. The care economy drives growth, drives human capital development, drives employment, but sometimes we do not put onto it an economic value. This is why sometimes we understand care, but we do not put numbers on it. So we consider that unpaid work is not really accounted in an economy, and that's a big debate. Around the world today, we witness a much more attention to this economy, to the care economy than we used to in the past days. And as this presentation unfolds, you will discover with me why. But first, let's define care together. Let's see how institutions, international institutions, define care. On this slide, you can find some of the definitions that are used in the literature. So Alonso, for example, he defines unpaid work that is not compensated by wage. And this is mostly the vast majority of care. Care it includes, in that sense, the paid and the unpaid. Unpaid work is defined by ILO also. ILO is the International Labour Organizations. And ILO did a typology for the care economy, whereby it divided it to unpaid and paid care, direct and indirect care work. So if you're interested in going more into this definition, I advise you to go into the literature of the International Labour Organization, which is mostly, today is the one that everybody follows. Knowing that, of course, according to ILO, according to the literature, according to all the statistics, and also according to our own, observation as human being, we can see that the majority of unpaid care work is provided by women and girls within the households, and care services that are provided privately or by public institutions who come and complement or substitute this unpaid work also are mostly carried out by women. So women are at the center of the care economy, and the care economy is a large part of, let's say, worldwide. The size of the sector and its impact on women is extremely large. This slide will focus a little bit on the size of care to show you and to share with you how much it is important. So And you can see from this graph that is provided by UN Women that worldwide, the overall size of the care sector is quite variable. When we say here, I would like to draw your attention that this is the measured care work. So what you see here are the number mostly of the paid work. So you could, this is why, for example, in countries which are like Mozambique, you can see it a very low percentage, but actually this is only the paid work. While in Denmark, most of the highest numbers are in countries which are more modern countries. This is where the sector is really a bigger developed sector. In less developed countries like Sub-Saharan Africa, like Vietnam, the care sector is big, but it is not accounted for. So when you look at the number and you look at the size, these are usually the paid care workforce that you see. But the message is that it does not reflect the actual size of both the paid and the unpaid sector. What is important and interesting to note is that the health and social sector are the major source of employment in the care economy, and that these are the two sectors where women are mostly present. So there is a large presence, of course, of immigrants in some of the sectors, especially social and health work, but generally, this mirrors also the representation and the labor force of a country in general. So you could see that in the mostly community health workers, for example, you can see most of the workers being women, sometimes immigrant. And these are the sectors where we can see sometimes from literature that they are frequently undertrained, under-resourced, underpaid, or sometimes unpaid. And although often we have, again, shortages of health workers. So there is a large, of course, need, but at the same time, there is somehow an undervaluation of this care economy in terms of also importance. In the health sector in particular, we noticed that nurses and midwife, they constitute the biggest occupational group. Nursing, of course, remains extremely feminized. Again, the extremely feminized of the healthcare occupation. And most of them, the personal care workers, most of them are home-based. Also there, we see that a big presence of women, but this is where we see also low wages, dire working conditions, and sometimes even exposure to discriminatory practices. So these are some of the what we learned from the literature. There is an important concept that we need to know when we talk about care economy, is this concept of care dependency. So, and the care, you will see it if you read about the care economy, you will see it coming a lot of time. This is a way of measuring the need for care relative to the population available to provide it. It's intuitive. I mean, it's not complex. Dependency ratio is how much you are dependent as a population on the need for care. And what is important to know are three major points that from world statistics, we get countries with higher dependency ratios for young children tend to be among the poorer countries. This is the first observations that we get from the statistics. The second point is that poor countries have some of the smallest care workforces. Again, here we are talking about structured care workforces, paid care workforces. And third, high fertility rates and the lack of institutionalized care infrastructure, they come together to produce a big gap in care services provisioning. So in countries where we have high fertility and we do not have an institutionalized care system, care infrastructure, there is a big gap between the need for care and the provision of care. And these are few of the numbers, and you can see from the table that in the Middle East, the care dependency ratio is somehow on around the 7 or 8 percentage point, whereas compared, for example, to established market, you can see that the dependency ratio is there, but it is going to increase as the elderly population grows in these countries. In the Arab country, the picture is very diverse. So there is a large diversity. We look at the care economy in these countries with a big loop, because what it goes in Egypt is different from what it goes in Tunisia, where it goes in Jordan. So there is a big diversity within the Arab region, and every country has its own dynamics. But remember that this is a region where you have the largest younger population, and the young age dependency ratio is projected to fall because there is a projection of a decline in fertility rates. So therefore, you will be less dependent with time. And there is a changing demographic shifts. On the contrary, the old age dependency ratio is expected to double. So what all this means is that as we go on in the future, we expect to be less dependent on young care, need for younger ages care, but we will need more and more people to care about old age people. And this is something that we need to construct in our planning exercise, because this will impact the labor market, and this will impact also the budgets of countries who dedicate some of their public budgets to finance the health and the education care needs. I will come to this point when we discuss why it's important to think about the policies for the future, and why we need to always project ourselves. Another view also from the Arab region is about spending. And I talk always about spending because we have to keep in mind that care economy has a large cost that either we choose to pay individually from our own pocket, or that is a cost that can be taken on public budget. So currently in the Arab region, the spending on health and social protection sector is very low, which means that there is only a fraction of the needs that is covered, and this we see it also in older person and old age protection. You only have to look around you to see how old people are not really being taken care of, and when they are, it's mostly on budgets that are family budgets. We can notice that the majority of the elderly population, and this is due to also the age factor, are women, and the access of services, of essential services for women old age is quite weak. And that the region, all the evidence point that the region lack residential and non-residential care services for the elderly. We lack trained care workers to provide social care services. And this is something that we need to keep in mind, because in the absence of these services, in the absence also of intervention from a public infrastructure, what will happen? What happens is that this burden will be transferred to the family members. And who in the family will bear this burden? Of course, mostly the spouses, the daughters-in-law. And this is going to rest on them, and they will be expected to provide the bulk of unpaid care for the elderly. So these are some foods for thoughts, because we need to think about how to actually bring the right policy response to the situation that is going to evolve very quickly in the coming years. And this is the projection that you see on the slide. So we have, in this part of the presentation, answered a little bit, and you probably now have a better idea how the care economy affects women. What we will do in the coming few slides is to actually dig more into it and talk about the different effects of care work on women, the positive and the negative effects. And let me start by this quote from the IMF on a recent work done by the IMF. And this is unusual for the IMF, but it's very interesting to see that even this big institution who only cares about stability, financial stability of country, came to look at the hidden cost of the unpaid caregiving, because there is a trend to look more and more into of who takes the responsibility for the care work that society are going to need in the future. And of course, governments will be, as you guessed, be invited to intervene more. So in this very interesting paper, which I advise you to read, it clearly states that the responsibility for unpaid care work worldwide falls disproportionately on women and girls, leaving them less time for education, less time for leisure, less time for political participation, less time for actual paid work, meaning their professional life, and for other economic activities. This is the conclusion of this very technical paper. And it's, of course, just, materializes what we all know in terms of numbers, evidence, and data. And to make it, very simple, you see this very, very simple graph in front of you. But it is impossible to talk about the care economy without recognizing how much it affects the life of women. We now recognize that the effect is not only that the burden falls on women, but it affects disproportionately women because it somehow let's say it prevents them for being what impedes them from not only economic participation, but from participating beyond the economy to political participation to the economy at large. Because women spend, when they do care work, they are spending most of their time, here we said 3.2 times more time on unpaid care work than men. So naturally, they are going to invest less in their professional life, and they're also their ambition to contribute to other sides of life. So in a mirror to what I'm saying, to mirror what I say, just imagine that you are investing in the care sector and you are structuring the care sector to be more equitable. You could imagine how this will impact women in terms of opportunity for women to accelerate equality and to participate more into to public life. So the effect on goes really beyond just paying for care work. It's really larger than that. What also the numbers and the very interesting numbers of the World Economic Forum tells us about this aspect of the care work and how it affects women is that the actually health sector, the health sector and the education sector, of course, being the two sectors where women are present, but the government and the public sector are the only sector that show a fairly balanced distribution of men and women across occupation. And even in the health, when the healthcare and care services, you can see in these two sectors in particular, how much women outnumber men. So you see them in the government public versus the government and public sector, where you can see how women and men are mostly, there is a fair balance. But when it comes to healthcare and care services, you see an outnumbering of women in the workforce. So it's somehow across all region of the world, you can see more women spending, of course, more time on this healthcare. And the numbers are in front of you to see that the time spent daily on unpaid care work and paid work out of total work is very disproportionate between men and women, leaving women to be what we call consistently time poorer than men. And across all regions, they have less time, again, to spend on their other ambitions. Let me go very quickly to the care penalty. Even when they work in jobs that are dedicated to care, here we notice again that there is a care penalty. Care jobs are temporary. Sometimes there are no contracts. Low salaries characterize care jobs, and of course overload and long hours. But even in these conditions, we definitely see that lower pay is prevalent, and it undermines the capacity of the workers to obtain a decent care for their family members, which adds again to the overall care responsibilities of women. Usually, this is a sector where, again, men are better paid than women, and where, of course, in much developed economies like Sweden, this happens less, but mostly in most of the world, it's not, the case is not like that at all. In the Arab region in particular, this care penalty also you could see here the employment issue. The issue of unpaid care responsibility as a barrier to women employment is a particular concern. We are in a region where anyway labor participation is not very high. And we can see how care, again, responsibility, whether in countries like Tunisia or Jordan, there is a growing evidence that women work double shift of unpaid work at home and when they work outside home. So they sometimes prefer to go out of the job markets to be able to handle one work, which is the unpaid work usually. So there is this second shift has a negative impact on women's well-being, and of course, sometimes poverty and the family dynamics, and certainly hindering equality in general. So sometimes engaging in paid work, we notice in the Arab region, versus staying at home full-time to take care for the family, is not a choice. While it should be a choice, in fact, in contexts, in particular contexts, it is not a choice. We think it's a choice that should be available to all women and men, regardless of their circumstances. But unfortunately, when there are no care infrastructure and care services provided, and this is the case of most Arab region, the burden again falls mostly on women, and they are disadvantaging them economically. This is a picture from Jordan. Women in Jordan, particularly married women, you bear nearly all of the responsibility for unpaid care work, and you can see it from this survey by UN Women 2020. And of course, there has been a deep study of this sector in Jordan because there is a governmental will to expand employment in the paid sector. And there has been some very interesting recommendations, mostly focusing on investing in infrastructure and investing in better labor market regulations to encourage women to go into the labor market. In Tunisia, again, the picture is not very far. So the ratio of women to man time spent on unpaid care work is nearly 6 to 1, meaning for every 6 hours a woman put, the man put 1 hour. And women are, of course, mostly disadvantaged here again. And there is no yet a clear policy to how to bring more equality to workers in this care sector. So we have a long way to go, and the effect of women is really for the coming years and for the coming decades. What we talked about is going to impact more and more and more women. And this is again the subject of this third part of the presentation. We are worried. We are deeply worried because by 2030, we know that the number of care recipients is going to explode. And we're talking about children under the age of 15 and persons above 60 years old. They are predicted to reach 2.3 billion and 8.5 billion respectively, which means that we will need more people to care about people. And this proportion may reach the quarter of the population, 23% by 2100. So the question immediately comes to our mind: how will women be affected by this explosion of the need for care? So childcare is going to increase, we know it. Aging is going to increase the need for care work, but mostly chronic health issues, which are again projected to explode, and dementia is an example. This all mean that in the coming 20 or 30 years, we will need more and more people to care again and to take the responsibility. And this cannot be only in informal family caregivers. So the care responsibility will need to be, of course, increased, but there needs to be some thinking, some policy thinking about how to cater for the needs of chronic health disease patients, for example. In countries, we know that there is an absence of social protection. This is a particularly important issue. And in countries where the demographics are changing rapidly, this is particularly an important issue. I will spare you the details, but what I want you to keep in mind is that as we move on, and by 2050, we expect an explosion in the need for care. And when we say that, we have to keep in mind that informal caregivers worldwide are women. So what will happen to women, and how to prevent that this need for care actually becomes a big burden, especially in countries where there are no public care infrastructure. So again, these are some of the numbers to show that how much life expectancy and the demand for long-term care services for older person is going to rise. And that the alternative for family care is very scarce until today. And we need to think, governments need to think, society needs to think about longer term provision. From where are we going to get this care offer, this care service? This is something we all need to think about, and to make actually care work for women and not become an overburden on women. This is question 4 of the part 4 of the slide, and I will end on it. There are different, policy options how to make care economy work for women and not become a burden of women. And I think that there has been enough, studies in the world to provide some interesting policy solutions. The classical policy response until today has been through parental leave options, but this does not work on the long term. There has been some provision to have, the care work taken care by NGOs, but this is also turning to be insufficient. And sometimes the state actually provide the care itself. But again, experience is showing that there is not enough, again, balance or offer from state, federal, or local. And of course, the fourth angle of the diamond is that the market provide paid care work. But this is, again, this mix of public and private is necessary, but you cannot leave it to only one actor. So the market cannot provide enough offer to sustain the demand for care in the long term. So evidence point to the need for a more orchestrated policy that provide for a space for state to act, for not-profit to act, for the market to act, and for family and household to act. So actually, if we want to think for the future, to lessen burden on women and to make the care economy work for women, the policy options that we have is a mix of policies that puts together all these actors of the care together and think to make them intervene in an orchestrated way so that they all take their share of the pie. And for this to happen, there are different models. One of the models that I like very much is called the purple economy model. And this is a model that works on the fact that the government acts as let's say, a policymakers and acts a universal social care infrastructure. The government takes care of the social infrastructure, care infrastructure by building and providing accessible, affordable social care services for both children and the elderly, and of course, the disabled and the sick. The labor market regulations are done in a way that improve work-life balance. So you have maternity leave, paternity leaves, parental leaves, flexible work care. Then these are integrated into the labor market regulation. And of course, there is somehow investment done in not only at the center, but in rural areas, so that also women that are in rural areas can have some, less burden, and they can participate both to the economy and to the care economy. And again, there is a macroeconomic enabled environment which can provide decent employment for women and can help also government leverage enough resources to pay for the infrastructure they are going to pay. This model is a very complex model. I just want to introduce to you the idea. We don't need to dig more into it, but just for you to learn that there are economists and models that think pro-women, and one of them is this model. This is the purple economy model. I would like to end on a note that is dear to my heart, to also link between what we project as needs to how a government should think, because the biggest actor on the market of care should be government, in terms of not providing the service itself, but providing the policies that make care economy work for women. And by policies, I mean policies related to the provisions of care services. So a government cannot be policy blind in what concerns the care economy. He needs to acknowledge the care economy needs and have some projection to understand how much this sector is going to need in terms of workforce, and provide directly or indirectly some form of subsidies, support to some sectors. And for this, he needs to have some buffers, some surplus, and work out a good public financial management so that we have some money left for this sector in particular. A government needs to have policies related to infrastructure. So, for example, make sure that potable water, clean energy, sanitation, electricity, roads, and transports are taken care so that care institutions can be built in rural society, and elderly or disabled or care beneficiary has less and less, difficulties in accessing these infrastructure. And of course, labor market policies that encourage all sorts of flexibility for women to be able to also pass on the burden to other members of the family. And finally, those important social protection policies that allow society to live in dignity, and by giving a very important example, the most important social protection policy is pension policy and universal pension for every person. So when they go out of work and out of the job market, they have enough, they have a pension system that actually prevent them from falling into deep poverty, and that can allows them to actually pay for the care service they need in their old age. I will stop at this point because I think this is a lot to digest, and there are a lot of interesting examples to give all over the world, but maybe this is time to take your questions. Thank you. Sarah, you are unmuted. You have to unmute.
Yes, sorry. So thank you so much for the presentation. Among the very interesting and insightful points that you've raised in your presentation, what got me thinking the most was the government spending, and through the inequitable distribution of social protection schemes in the MENA region, which fuel the burden of unpaid care work on vulnerable groups, including and not limited to women and migrant domestic workers. The nexus between gender and care work, and the case studies from Jordan, Tunis. I'd like to add also Egypt to the pool of examples, but most importantly, the policy options and the recommendations that you've provided, and the concerted efforts that are required, not only at the level of social protection and care, but the labor market and the labor law policies and care infrastructure. So thank you so much for this presentation, Lamia. I'd like to open the floor for questions from our participants. If you have any question, please do raise your hand and we'll open the floor for your intervention.
If not question, any comment or reflection? What captured your attention? Were you expecting this? What do you think about the policy, options presented? Any comment is welcome.
If I can entertain a question, probably will encourage participants to contribute. But you've mentioned the government spending and the need for the government to chip in, because efforts towards the care economy, with the reducing and the redistribution of the care burdens, and shifting from the care economy being a burden to an opportunity of investment for women and vulnerable groups. And there is a dire need for governmental intervention. What are challenges that we can foresee, or at least think of, when lobbying governments for starting to look at care-friendly policies and implementation?
Sarah, thank you. This is a very important and questions, and you rightly pointed the finger to where the pain is. First of all, we have to remember that when we address governments, we need to understand the macroeconomic environment that they are operating in. And for the time being, for what it looks, we are in a period where the global growth is very slow and is projected to slow again. So there is in 2022, we were at some 3.5%. In 2024, we are less than 2.9%. The forecasts are at their lowest in decades. What does this mean? It means that the economies are not doing well, and therefore revenues for the government are not doing well. With inflation, meaning the rising of prices all over the world because of wars, because of conflict, because of trade routes blockade, all this is making all the markets very volatile, but also lots of inflation pressure. So what does it mean? Mean the prices of everything is climbing, and with all these geopolitical shocks. So also this puts more pressure on government. But when you have so much pressure, what does this mean? It means that a government has no room for policy error, because any error you make now, you will pay for it in the coming 10 to 20 years. Policymakers should think of maintaining a very, very good financial management and budgetary flexibility and maneuver, because there will come years where they will be solicited to pay more, and they would need to really run their finances very well. And we as citizens, we need to understand that it's important for us to put pressure on government to have very good public financial management, not because l'art pour l'art, we want them to, manage money well. No, because we need them to spend well where the need is. And where the need is in the care economy for the coming years. As we saw, this is not a sector that government look at very closely. Okay, so government don't think about investing in universal social care infrastructure if left alone, if you want. This is where the action of activism, of civil society, of professionals, of academia, of researcher has to come extremely strong and say, hey, people, we are going in a world where you will be pushed or invited to do more and to intervene more. And let us discuss and work together to find how you can manage today better to have more room to spend for the future. Because care industries can be at the same time a place where the government puts money, but at the same time, they are also driver of employment and growth. So they can create it's a loop. They can create economic opportunity. If you invest in universal social care infrastructure, and you create an industry that can provide employment for women, for men also, and it becomes a global, it creates care jobs. So it becomes if you want greater investment in the care services, they can create, actually the ILO said, if I recall well, that if a greater investment in care services can create globally some 300 million jobs. So if you increase your investment in care, in health care sector, for example, as a government, you will have a return. Not only you will be doing good, but you will also have a good return. So manage your money right, spend and invest in the care industry, and you will have lots of externality.
Thank you so much for the very comprehensive answer. I had Ammar. Ammar, are you still with us? Would you like to intervene or a question?
Okay. That is my question. That's a very positive session. Thank you, Ms. Lina. And also hold the Aspiring Institute. In fact, my question is, I'm wondering what kind of interventions that INGOs and NGOs can help in providing the care, providing interventions in care systems, and also what kind of policies that can work with the government to identify.
Great. Thank you, Ammar. This is very interesting. I think we can divide them into four important, pillars. The first pillar is investing in universal social care infrastructure. You have to help the market and also as a government act towards building infrastructure. You need care centers. You need the market to build care centers, and you can give tax incentives, for example, or investment incentives, and you can build them yourself if you are, into this. The second pillar of policy here in the care sector is labor market regulation. Okay, so these are regulations for childcare services advantages. For example, you can reduce price of childcare and do some subsidies on childcare. You can also encourage and make sure that maternity protection laws are voted. In the Arab state, for example, countries meeting ILO maternity protection standards are not there. There is zero. Mothers with newborns receiving maternity cash benefits is very, very little. Labor force participation of women living with children aged 0 and 5 needs to be regulated differently by giving them more flexibility, more time, more flexibility. These are the kind of regulations that you can introduce. Transfer of the maternity leave period to father. This is the kind also of labor market regulation you can, and there is a whole panoply, if you want, of measures that you can implement. You adjust your labor market regulations. This is something government can and must do. This is the second pillar. And of course, again, there is encouraging more investment from the market, meaning that there are healthcare providers. They can be specialized care providers that can be para-hospital or annexes to hospitals, and you can create incentives for these for the market to bring in these kind of services and make sure that there is regulation for the cost of them. So if you remember the diamond in the slide, think in terms of this diamond. The family household, you can protect them by labor market regulation, encourage the market to provide services, encourage non-profit to again provide the services, and as a state, invest in infrastructure.
Okay, thank you, Sulaiman.
Okay, any more interventions, comments, questions? I just thought of a question right now because
we have some comment in the chat box, I think, one in Arabic and.
Okay, Ammar has another question.
Please come in.
Okay, do we start with Ammar and then we move to Nusayba, or we? Okay, so I'll read Nusayba's question and then we'll come back to Ammar's second question. تعتبر معدلات مشاركة النساء في القوى العاملة باليمن واحدة من أدنى المعدلات على مستوى العالم، وقد أدى الانهيار الاقتصادي الناجم عن الصراع الجاري إلى تدمير هيكل سوق العمل في اليمن. كيف يمكن تعزيز مفهوم العمل الرعائي في ظل الصراع القائم؟
Shall we answer in Arabic or in English?
There is interpretation, so I
Okay,
think,
excellent.
yeah.
Yeah. Right. Thank you, Nusaiba. I met Nusaiba in a different, context, and I really value her contribution. And she's right. Labor market participation is a big issue in the Arab world, and actually it is the lowest compared to all other regions of the world. But this is what the actually formal statistics, when you say labor market, it is the formal economy. Actually, does not mean that women work less. On the contrary, they might be working more, but this is not reflected because their work is mostly either unpaid or in the informal sector. Um, and of course, with geopolitical stresses, with conflicts, with wars, we all know that the burden on women is much, much higher than it is on any other bracket. Women and children in general bear the cost of conflict. And one of them is that the labor market structure falls. And you are right, Nusaiba, that this limits participation on women in the formal sector and puts more burden on them to dedicate to caring for the family. I think that we need to, as society, have more clarity about what is care work, why it is important, and how much it is valued. So starting by explaining what I just explained, or I tried to explain, I hope I succeeded in these few minutes, in this half an hour. So care should not be taken for granted, and we should try to pass on the message to the younger generation that this is time spent and time that has value. If today I take care of my elder mom or my elder aunt, this is a time that has a cost, and this cost today is not costed, but it's actually part of the economy. And if we were to pay for it, it would cost that much. Though there is a lot of awareness to be done at the level of the educating the youngsters, but also educating our peers about the value of care. And it's very hard. I acknowledge in our society, it's taken for granted that women, daughters-in-law, they should take care. And this is part of their job. This is part of their identity. Yes, again, but there is a need to bring more awareness. It's only through awareness, through education, that we can make care recognized as an economic driver of value. And by putting some numbers on it. So we can say, hey, do you know what is the market value of care work? Well, let me tell you, and then we can bring the numbers that we have from other contexts and show them how much it costs. I hope I responded a little bit to you, but I think we have a long, long way, Nusaiba, to go, because it's very, very hard in our society to shift mentalities when it concerns care economy. But it all starts with education and awareness, and with sharing also the burden of care work, because it's only through sharing that we can start shifting mindsets.
Thank you, Nusaiba, for the very insightful question. I'd like to move to Ammar. Ammar, you had another question. I'll give you access. All right. Okay.
Okay, it was the same like Siva's question, but I have another question. Does we consider that the vulnerable group are the most important group that we focus in providing or implementing healthcare interventions and programs, or should we also consider also the high income people or groups?
Uh, I, I couldn't hear you very well. Maybe Sarah, or if you can repeat it.
No, if you can, because the voice is not really clear. Can you type your question, Ammar, in the chat? That would be
Okay.
great, if that's okay with you. Okay.
I
In
think,
the
yeah,
mean-
because the quality of the network was not great.
in the meantime, we do invite anyone who has any comment, any suggestion, any question. The floor is all yours.
If I understand, I mean, hinted to, if this is what Ammar was hinting, is yeah, but it is a point to make. If when you are as a policymaker thinking about increasing women labor participation, and I think this also is important again, or a correlation with Nusayba's question. You know, we all discuss as economists, how can we increase women labor participation, as also, you know, governance and activists, how we increase women participation in political life. And sometimes when we are discussing these two very important issues for actual gender equality, we have maybe to keep in the back of our mind the time that is requested from women to devote to care work, and see that as major impediment to achieving our objective in increasing women's labor force participation or women's participation in political life. I have rarely seen discussions around these two issues bring this angle of challenges. And frankly, I was also one of those who was blind about how much the care economy undermines women participation to the economy and to political life until I started working on the care economy. So we are all, you know, extremely enthusiastic about decreasing inequalities and improving women's labor for participation, improving the number of women in political parties and the number of women in leadership position in government. But we forget that we cannot do that unless we address the issues of care in a parallel way.
Thank you, Lamia. And if I may also add a small reflection on this, when it comes to political participation, specific for senior positions, this is where the care burdens become a very serious issue on women's careers in political life, because politics requires a huge amount of informal institutional work.
Absolutely.
That is not really enforced within the official channels of enforcement. And so women are in that position where they either have to compromise the care responsibilities that were bestowed upon them because they were women, in order to make up to the work on a professional political level, or they have to actually be excluded from these informal institutional settings to accommodate to their families' needs. And so here, this puts women in such positions in a more vulnerable situation and in a more exclusionary situation vis-a-vis their peers and their male counterparts in specific. So
absolutely. And to just, you know, put some numbers into what you say, according to the latest report by the World Economic Forum, it's called the Global Gender Gap Report, 42% of women cannot get jobs because they are responsible for the caregiving, compared to just 6% of men. So you are starting here from this premise, and the same would go also for political participation. So you have to really look into policies that address the care economy if you want to really be effective in addressing all other sorts of imbalances.
Absolutely, absolutely. So do we have,
Go back
okay,
to Ammar.
yes. So the most affected from care systems and policies are the vulnerable groups. Should we consider the vulnerable groups like IDPs, migrants, only in designing the care programs by their needs?
Yes, of course. I mean, when you design any policies, you have to take into consideration all the those that the policy affects, and of course, IDP migrants again are part of the equation today, especially in our part of the region. We are in a region where migrations, refugees, the numbers of refugees, number of migrant people are kind of the highest in the world, especially in the latest couple of years. And so our policies have to address everybody. And this is quite intricate because we are at a time where there is a lot of pressure on public finance from, again, from the global threats, economic threats and war threats and inflationary threats. So it's quite a tense period. But again, this is why I said we are at a time where policy error should be, limited to the minimum. And actually, we cannot even afford to have any policy errors. And this takes us, of course, to the when we say no room for policy error, we say also policymakers. So policymakers and the quality of policymakers in these dire times are extremely important, so that we do not make error in the policymaking exercise. But that's a totally different discussion. But again, everything is politics related.
So I think we don't have any more questions in the chat box. Any reflections, any comments, questions from the audience? Okay, we have from Samantha Elia. Samantha, please, the floor is yours.
Hi. First of all, thanks a lot for this very valuable presentation and your input that I find quite interesting, to be honest. And I think one problem I have in this entire process is that I don't understand if the direction you are moving into is to say that we need to create care jobs or that the care economy will create jobs, or that we're talking more about the ethics of valuing care as a society, the ethics of valuing reproductive work as a society versus the creation of jobs. And I'm asking this because we had this discussion before with my peers, and we were talking about what would happen if we create care jobs, if we create more care jobs, and then the women are free to enter the labor market. But what kind of society are we raising? So I think my question is more like, how do we balance both? How do we actually value care work and actually give the choice to women while preserving the freedom of people to choose spending time with their families or choose to take care and raise their families? So how do we make this choice thing happen?
Thank you, Samantha, for it's not a question, it's a reflection. And I think you have kind of also touched the heart of any policy-making exercise. And the heart is the need for a balancing act. I mean, there is no right and wrong way. There is a kind of a balance to try to achieve a policy objective here. starting from evidence, because we believe that evidence, we should all make policies based on evidence, not based on dogmas or beliefs. All the evidence around us is pointing to what? To a larger need for care. So this is number one. Number two, all the evidence around us is pointing out to the fact that women are the ones who are basically doing most of the unpaid care work. But also, at the same time, it's a big challenge, but at the same time, it's a big opportunity. If there is a big need for care, this means also that there is a big opportunity for jobs in the care sector. But what we need to make sure to do is to make these jobs, first of all, recognized. And this we can do through policies, regulations, etc. That it's paid so that it is valued. And this also, there is a whole set of policies and regulations to implement, including decent pay, including access to training, including you know, all these, you know, important benefits that should come with the actual formalization of care. And of course, being there as a regulator in the economy, the government or the policymakers, to put enough regulation and to watch this market. Women who would like to be, or men who would like to be invested in jobs may have the choice. So what you need as a policymaker to do is to turn this threat, because I think it's a threat, to an opportunity by investing in this sector and making sure that you have access to these jobs, and give the choice to women who do not want to be really caregiver to be able to free their time and go do something else. And this we can only happen if there is enough care infrastructure and care service provided. So it's a complex balancing act to do, and this is why you need excellent policy making. I hope I was a bit clear. And I hope
Yes,
it's
thank you.
clearer in your head. It is not a simple matter. And this is not only, it's not about only care, but it's very interesting to see that this threat of an explosion in the care of needs for care, you can turn it into an opportunity for women. At the time being, it's a threat, but you can turn it into an opportunity.
Thank you, Lamia.
Thank you. May I say one more thing?
Yes.
As a reflection on what you just said, basically our fear in the discussion was to turn like care work from reproductive to like another kind of commodity in the capitalist world, you know, and and who will pay the price mostly? It's, yeah, it will liberate women, but usually it will liberate women that are already on the high end of the hierarchy and put the like heaviness on, which is kind of happening right now, but the fear is by turning or creating more of these care jobs that women from the lower end of this hierarchy will, or even men, but from data it's mostly women, will take on these jobs, liberating women who are already privileged or educated or have the means to enter the labor or have the choice, basically. So this is why I asked this question, but I completely agree with what you said, and it is a very sensitive, complicated matter, and I think it's not only excellent policies, but also good following up and accountability mechanisms that keep this in track. So yeah, thank you.
Absolutely, Samantha. And I read you, and this is why, if you remember when we saw in mostly you see in developed countries, the care sector when is developed. And what we're noticing now is that worldwide, especially in developed country, this sector is one of the fastest growing sector of the economy. So you have more paid care workers that are also, opportunities for men and women. This is the labor force of tomorrow. By contrast, in countries with the smallest, economies, like Sub-Saharan Africa or others, you notice that the burden lies on women and there is no care economy per se. And that's again the whole idea of having very good policy making for this sector, because it can free up women, yes, and they can have a choice. And I think the word choice is what we need to put forth.
Thank you, Lamia. We had a question from Rima Nazir.
Yes.
Hey, hi, can you hear me?
Yes. Hello.
Hey, hi, thank you. Hi, Lamia. I have a quick question على قصة care. Yes, we are used to in our societies that women take care of the elderly and the children and everything. But my question is specifically about elderly people, whether the parents or the grandparents. The issue is if you try to find this, I'm not sure how many specialized centers we have in Lebanon for elderly people who are respectable enough so you can send your parents to. But the thing is, if you even think about finding such places, people would say, "Oh, you're sending your father or your mother to the elderly place." I'm not sure how much, and not forgetting that some of the parents will have dementia, whatever kind of malady that the children cannot take care of because we're not nurses, we're not doctors, So the issue is, don't you think there should be some, what's the word? نسيت الكلمة. توعية، نسيت الكلمة.
Awareness.
Sorry, yes, awareness. There should be some awareness for the society to understand that it's not that the children are running away from responsibility, whether they have the time or not for that, whether they have jobs or not to fulfill. But it's more about maybe they cannot do the job, and it might be more harmful for the parents, for their children to take care of, just because they cannot really do it because they're not, doctors or so. Thank you.
Very, very good point, actually. Thank you, Rima. This is a very, very good point. And actually, I think that with the development of the economy and the explosion of the need for care, society, including ours, will be kind of obliged to look at care provision differently. Because people cannot afford anymore to do unpaid care work because the pressure, the economic, the inflation pressure are rising, but also because, again, and as I said, there is also an increase in the age expectancy, life expectancy, and therefore also lots of needs in terms of chronic healthcare issues, which you as a family member and untrained family member cannot provide. So the responsibility for an informal family caregiver cannot be actually fulfill the needs when for a person with a chronic health disease that can be dementia or other, but can be also, more complex also issues. So in this circumstance, with these changing demographics, with this changing care need characteristics, society will need to find the right solutions, and the right solutions will come. And of course, awareness will help, but I think it's the pressure of the demand that will change also the position of society and the mindset in society. Now, what helps today, what helps is that to create, this is where policy design is important, to have people who have the capacity to project themselves for the future and to prepare to design the right policies and the right infrastructure, so that when together with the evolution of the need of society, there is an offer of services. Today, you do not have enough quality care infrastructure even to respond to today's needs. So شو رح يكون بعد كم سنة? I mean, imagine what will happen in few years' time. You need to prepare today for the needs of tomorrow. And this will come eventually, but it can come smoothly if you have the right people and designing the right policies. And it could come, you know, with difficulties and atrocious difficulties if you just let it happen by itself. Unfortunately, in our part of the world, we have to always be in the, not in the anticipation, but on the reaction. In other countries, it happens in a different way. But I am definitely recognizing the challenge of destroying this taboo about care being provided by a third party.
Sorry, I didn't get your last sentence.
I think it is a very important thing to start creating awareness about the care needs and the care provision, so that in the mindset of people, you destroy this taboo about care not being or society having to put the burden of care on the family caregivers, and to start believing that this care can be provided by a third party, which is the care infrastructure, what we call the care service infrastructure. Meaning you can pay for these services in a specialized institutions that really is habilitated and professional to take care of the needs of those elderly cases, or not necessarily elderly, but those who needs the care. But yeah, it is a mind shift, but I think the market will help a lot.
Thank you so much, Lamia. Since we do not have any more interventions or questions, and before we wrap up, if you have any final reflections on today's webinar, and then we'll call it a day.
Thank you, everybody. Thank you for the very interesting questions and very interesting discussion. I hope it completed your the picture around care and the care sector. It's always a very challenging and important part of our studies. So thank you, Asfari.
Thank you, Lamia. I'd like to extend our sincere gratitude for having you with us today and for sharing your expertise, your insights. And I also want to thank the attendees for the active participation and very interesting and thoughtful questions. Before we close, I'd like to encourage everyone to stay connected and continue the conversation on care, whether through follow-up discussions, research collaborations, or advocacy. So I think that we all need to work together to drive a positive change when it comes to the care economy in the MENA region. So thank you once again, everyone, and have a wonderful evening. Bye.